Myanmar's military regime is estimated to have killed nearly 900 people and detained thousands of others since seizing power in February. Now it seems it's intentionally targeting doctors and nurses. At least 12 have been reportedly killed in the last 5 months alone. The WHO says Myanmar is currently the most dangerous place to be a medical worker, and a warning to viewers may find some parts of this following report distressing.
Health workers protesting against the new regime. That's when the junta decided they were a threat. Since the coup, medics have faced attacks like this by the military, says one fugitive doctor.
The public call the doctors as heroes due to our actions in the COVID pandemic last year. But we have become criminals overnight by the military. Treating and seeing patients isn't illegal in any part of the world, but in Myanmar.
That forced many practitioners to go into hiding, but escaping persecution isn't easy. Many of them had been arrested while working in underground clinics, treating injured protesters wounded by the junta's brutal crackdown.
All the medical equipments were confiscated, and my colleague and 4 doctors and a nurse were abducted while they are seeing the patients. You can say that I'm lucky because I have escaped many times.
The doctor is one of many health workers who refuse to return to hospitals now occupied by the military. A decision heavily criticized by the junta government. They're killing people in cold blood. If this is not genocide, what shall I call it? A claim the medics deny. They say no one now dares to seek medical care in hospitals run by the military. All of this, in the middle of the coronavirus pandemic, has created a healthcare crisis.
But the junta doesn't seem to mind this and continue attacks on the healthcare, while the military and their families have all been vaccinated.
Doctors fear its public health system could collapse at a time when people are already suffering from a political turmoil that seems to have no end.